ZNS Network, the People's Station.
You're watching the ZNS Health Zone. ZNS Health Zone is sponsored by Doctors Hospital. Other sponsors include the National Workers Credit Union, Freeport Insurance Agents and Brokers, and Insurance Management.
You've entered the ZNS Health Zone. I'm Shashina Wolf-Parkinson. Thank you so much for tuning in. February is designated as Heart Month, and statistically, heart disease is the leading cause of death here in the Bahamas. Well, tonight for 1 hour, we speak with a cardiologist at Doctors Hospital, Dr. Alejandro Maspless, and we will dive deeper into this topic and tell you everything that you need to know. Dr. Maspless, thank you so much for being with us tonight.
Thank you, Shinda. It's a pleasure for me to be here. I am very happy to work here at Freeport, and thank you very much.
You're welcome. Now, we know that this is a very serious topic, as we would have mentioned earlier. Heart disease is one of the leading cause. It is the leading cause of death here in the Bahamas. Talk about what your journey has been like as a cardiologist here in the Bahamas.
Yes, we have a problem here at Bahamas with heart disease because it's the first one cause of mortality here at Bahamas and worldwide. Many conditions can modify the heart function, the cardiac function, and affect the heart, like disease, coronary artery disease, heart attack is the big one. Many patients is a big problems, high mortality, also arrhythmias, extra beats, heart beats. Is very frequent in our population. A larger heart also is a big problem. But we are working on that, and with medication and controls, many people have a benefit about that. It's very important, first, that the patient know about the problem, and the people need to go to the doctor to control, to talk about your situation. And I think it's very important. First, the people need to know, and then, of course, the doctors will work with the people.
And so let's dive right into it. You talked about heart attack, a type of heart disease. I think every Bahamian knows someone who would have suffered a heart attack or someone who would have died as a result of a heart attack. What are some of the warning signs that tells you need to go and get to a doctor right away? This could be a heart attack.
Okay, no, the chest pain is always an emergency. If the people have chest pain, like a pressure in the center of the chest or in the abdomen, the epigastric pain or back pain, need to go to the hospital. Because heart attack is a high mortality. Doctors, hospital have many things to do, and the patient can be better in the next hour. Chest pain is an emergency. The people need to go to the hospital, no delay. Many times the patients in the Super Bowl say, okay, we will wait 10 minutes. I will take water and will improve and delay 10 minutes, 30 minutes, and then, okay, go to the hospital, delay other 30 minutes. No delay. The best strategy is go to the hospital right now.
So my question to you is, with the chest pain, is it usually a sudden attack of chest pain, or is it a slow onset, maybe with the pressure in the chest area, or you start to get this back pain? Is it usually strong and intense, or does it come on gradually?
Okay, depend of the patient. Many patients with diabetes have no chest pain, have a shoulder thread. Patients with many patients have previously have angina, have chest pain, but go back, and we have many patients, sportman, high level, and right now it's normal, and the next minutes have strong, heavy chest pain and heart attack and need treatment. I think it's very difficult for me to say, okay, if you have this chest pain, exactly this type of chest pain, go to the hospital.
So it's any chest pain?
Yes,
any chest pain.
Any chest pain.
You go to the hospital. And as we were talking earlier, you mentioned the importance of understanding that once you have this chest pain, there's no such thing as a delay. You don't wait 10 minutes, you don't wait 20 minutes, because every hour you could actually reduce your chances of survival.
Yes, of course. If you delay 1 hour, the mortality increase 10%. Each hour that you delay is 10% of mortality, increase the mortality. I prefer that people go to the hospitals, ECG normal and lab works normal, okay, no problems, come back home. That delay and develop a big problems in the next 2 hours. Of course, every patient is not the same. Patients with diabetes, patients with hypertension, patients with the history of heart attack need to move quickly, because diabetes, hypertension, history, smoking are risk factors, and the probability will be higher than other patients.
You mentioned another type of heart disease is, scientifically you called it something else, but I would say palpitations, the palpitations that we usually get. I know certain foods I can't eat because I automatically get these palpitations. Do you take these palpitations seriously every time they happen, or when should they be taken seriously? I think mine is maybe MSG, or certain things I can't eat. I automatically feel my heart just the fluttering.
Yes. Probably arrhythmias or palpitation need an evaluation of the cardiologist. We have low-risk arrhythmias and high-risk arrhythmias. but the patient don't know
Right.
what happened. We need to do an ECG, probably a Holter, to check everything and make the right diagnostic about that. A very frequent arrhythmia is an atrial fibrillation. An atrial fibrillation is a risk factor for stroke, for heart disease, and or probably is extra beats, supraventricular extra beats have not risk, it's low risk, but the patient need an evaluation, and I think if you have palpitations, go to the
Go and get it
cardiologist.
checked
Yeah,
out.
sorry
No
for
delay.
that.
No delay. I agree. Enlarged heart, another type of heart disease. How prevalent have you seen that here in the Bahamas? And what are some of the symptoms that may indicate that this may be an issue for you?
Okay, the shortness of breath is the symptom, and patients with hypertension, chronic hypertension, with diabetes, need to be in touch with the doctors, because the risk of heart enlargement in this patient is bigger. The treatment is with pills, with tablets. It's easy. Right now, we have very good medication for that, and it's a good decision to go to the doctor. But with this patient, it's very important. We can prevent the enlargement. We can delay very much the development of this disease, because we can control the blood pressure, the high blood pressure. We can control the high blood sugar. The patient is a big problem for the patient, because the quality of life will be totally different with a low function, with a low ejection fraction. And I think it's a good decision to control the high blood pressure and the high blood sugar.
Now, maybe someone who is watching this may say, okay, I've had none of those symptoms. So let's talk about risk factors that predisposes someone to heart disease. What should we know?
Yes, the 3 or 4 most important risk factors is diabetes, high blood pressure, smoking, and high cholesterol. If the patient have diabetes, have 10 times more possibility to develop a heart disease, 10 times. If the patient have hypertension, 4 times. If the patient smoking, have 20 times. High cholesterol is around 5 times. But if the patient have 3 high risk factors, have 50 times more possibility to develop a cardiac or heart disease. And we can treat this patient. We can modify the evolution, the natural evolution of these patients with a pill, with one pill daily.
And it could save your life.
Yes, totally. And I think the experience for patients with chest pain is so bad that, but Bahamas have very smart people, very smart patients. No wait for the chest pain to modify the risk factor.
That leads me into my next segment, prevention. What do you do then to prevent cardiac disease?
Prevent cardiac disease is diabetes first, type 2 diabetes, hypertension, smoking, high cholesterol. The diet is very important.
Yeah.
Bahamas have a delicious diet, but it's very bad.
Yeah. Yeah.
Sorry for that.
Right. Good food, bad diet.
Yes, I agree. And exercise. People need to make exercise and a healthy life to prevent cardiac or heart disease. Also, stress, laboral stress is very important. I have experience with patients in the line on the bank with problems with the bank, of course, chest pain and death.
Wow.
I think we need to be smart with this promotion, with this, because prevention starts when the people is young people. No wait for elder people with chronic hypertension, with chronic diabetes. No, we need to start early. Control, one tablet daily, cheaper, is the best option.
So my question to you is, if someone is experiencing some of the symptoms that you would have discussed, the hand, jaw pain, chest, the pressure on the chest, I know we've seen before where they say you can take a Bayer, still go to the hospital, but maybe aspirin or something while you're feeling these symptoms may help you in some way. Is that accurate?
Okay, aspirin, no baby. 325 milligrams. Aspirin is a good option for patients with a heart attack.
So that's if you've already been diagnosed with a heart attack. Is it good to take it daily or when?
No, okay. It's a big discussion. Many Congress and many doctors talking about that, but the primary prevention is control the risk factor, no aspirin. Secondary prevention after heart attack, yes. Baby aspirin, 81 milligrams every day, long time. But aspirin is a medication that decreases the mortality in myocardial infarction, in a heart attack, 50%. It's a good strategy if you have chest pain. Okay, go to the doctor. Okay, take an aspirin. And then
hand to the doctor.
Yes.
Thank you very much, Dr. Masplez. Stay with us. We're just getting started. Coming up next, we want to talk about heart health and your children, because as we know, heart health does not just affect certain people within certain categories or who have underlying conditions, but what does heart health mean to you and your child? Also, coming up next, we will speak with a man who survived a triple bypass. His story when we return. Stay with us.
You're watching the ZNS Health Zone.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
All your insurance needs, life, health, homeowners, marine, and so much more. We are Freeport Insurance agents and brokers located at Freeport Insurance Center, number 21B West Mall Drive, Freeport, and in Nassau at Suite A3A, East Bay Plaza, East Bay Street. We specialize in you.
Insurance Management Bahamas Limited.
Maintaining strong relationships with superior customer service. Fulfilling all your insurance needs through commercial, property and casualty, marine and aviation, homeowners and contents, automotive for private and commercial, life insurance, medical, and pension investments. Being the best at who we are in Freeport since 1980.
Insurance Management Bahamas Limited.
A name you've come to know and trust.
We've always been there for you.
So call us today at 350-3500 or visit our office on Pioneers Way.
Insurance Management Bahamas Limited. Honestly,
nobody does it better.
We all need to save time, gas, and money. Shopping at Save More can help you do just that. Make us your first stop for all your prescription needs and medical supplies. Get all your health and beauty items at the same time. And don't miss our huge choice of snacks to satisfy your cravings. And the largest vitamin selection and over-the-counter relief products. Need diapers and other baby care items? First stop. The new section for makeovers, cosmetics, and beautiful jewelry will make you sparkle for that next special event. Save More Drugs, your more store.
Make the best decision of your life and become an active and valued member of National Workers Cooperative Credit Union today. Call 352-9624 or 826-8670. National Workers Cooperative Credit Union.
Doctor Hospital have a great commitment with Freeport, with Grand Bahama. Doctor Hospital made a great investment in the building. We are a great team. We can check everything in cardiovascular problems, working with ECG, of course, with Holter monitor 24 hours, echocardiogram, stress test, and eco stress. So we have more than 100 patients in the last 3 years with very, very good results. 80% of population have hypertension. 60% of patients have diabetes, and around 40% of patients have more risk factors. These patients need support, need technology, need a team, no a cardiologist, no a technician or a machine. Need a team because the risk of complication in this patient is very high.
You're watching the ZNS Health Zone.
Welcome back to the Health Zone with ZNS. Our next guest survived an aortic stenosis back in 2017. Here's his amazing story.
Nearly 3 years ago, Derek planned an ordinary trip from Grand Bahama to New Providence for a business meeting. Once he arrived, he says he started to feel ill, but he didn't think it was anything threatening.
The meeting went well, and after the meeting, somewhere between maybe 3 and 4 that afternoon, I began to feel not chest pains, but I began to feel a shortness of breath, having difficulty in breathing.
Once Derek got to the cardiologist, he says the reactions of the doctors after examining him caused him to worry because it seemed as though something was wrong. He says shortly after his examinations, doctors instructed him to prepare to be admitted to hospital for open heart surgery.
And what was said to me is, you're not to go back to Grand Bahama. You are to meet me, this was the doctor, at the male surgical ward of the Princess, this was a Friday afternoon, the male surgical ward of the Princess Margaret Hospital at 9 o'clock on Monday morning. He allowed me to go home with my sister, But being the kind of person I was a little rebellious. And now that I understand, I'm lucky things went the way they went.
Derek was eventually transferred to Mount Sinai Hospital to have the procedure, which was valued at $75,000. That's when he and his family went to the public for assistance. Today, Derek is strong and healthy and credits God, the doctors, and all who played a part in his journey to recovery.
The morning of the 2nd of October, if I tell you that was a happy morning, I will be telling you a story. Not because I was afraid of having the surgery, but the question was then, my condition is what it is, the anesthesiologist will put me to sleep, and only God knows whether or not I will return.
Thank you so much, Derek Sands, for joining us tonight. Your story is an amazing story of both survival and the will to live. How do you feel? I know this would have happened in 2017. Years later, how are you doing?
Well, I'm doing, first of all, thank you for having me with you tonight. I'm doing very well. And all of this could be contributed to Grand Bahama, the community, and to the doctors who provided the services for me. So there are quite a number of persons I must thank for the opportunity to be here today. Well, first of all, we thank God for it. Mm-hmm. And if we were to call them by name, it's just too many names.
Right.
So before I miss anyone, all right, and slight anyone, I prefer just to speak to the community who came to my aid. Wife, family, children, and the like.
When you look back, you take us back to 2017. Were you having some sudden symptoms that you think that you could have paid attention to?
Yes. Some of the things that I could have paid attention to was shortness of breath. I found that the ability to do difficult tasks, they were becoming difficult. The possibility of walking long distances shortened. And at night, during the sleep period, I would find myself sleeping for a couple of minutes, then I'm awakened with shortness of breath. All right, can't breathe. It happened for a couple of days, didn't pay any attention to it, hoping that it will go away. I did come back to Grand Bahama.
So you felt fine outside of, you know, the shortness of breath that you would have had before.
That's correct.
Dr. Masplas spoke about, you know, shortness of that breath being a symptom along with some other things, and driving home the point that when you have these feelings and these symptoms, There's no such thing as I'm going to wait, I'm going to drink some water. You have to treat it with urgency, no delay. What do you say about that, especially for the men and the women who are listening? Women, more than likely, tend to, we'll go to a doctor. We're okay with that. Right. But for the men, yes, a lot of times men will not even discuss having certain symptoms until they absolutely can't take it anymore. What do you say to the men who could possibly be in your position even now, who is delaying that doctor appointment or that visit to the emergency room?
I'm happy you asked the question, because men, we have a lot of pride. And when it comes to pain, among other things, we feel we don't want to trouble our wives or our family with this. We might be able to live through it. Eventually, it will go away. And I agree with the doctors. If this happens, men, please, for the life of us, all right, please go and see your doctor. Very, very important. And the worst of it is, like I said a minute ago, we believe we could do any and everything we choose, because right then we feel all right, other than this slight shortness of breath. And I could tell you the wrongest thing I could have done was when I hopped on Bahamas Air to come back to Grand Bahama, then to return to Nassau, because it worsened actually. And again, with regards to what you said, my wife will tell you today, I didn't tell her the true story. I didn't tell her what my condition was.
Why not?
Well, the thing about it is, women ask a lot of questions, Of
course. I know.
And a lot of times we're not prepared to answer the questions in the ways that we should, because the thing about a relationship, a husband and wife relationship, many times you feel for each other. And not to cause my wife to worry, I figured it was better that I say very little about what my condition was.
But do you regret that now, retrospectively? Should you have told her what you were faced with?
I regret that today, simply because she would not have allowed it to go to the extent that I went. Women will tell you, buddy, you ain't going to come, you going.
Right.
All right, I ain't asking you questions anymore. You go to the doctor, right? And if they got to get to the point to call the doctor, well, doc, he don't want to come, but he's coming. All right, so yeah, and we do find we regret many, many things, because I wish I had said to her during the course of the period between July and, March and July, how I felt many times. But sometime, believe you, and maybe this is the first time she will hear this too, sometime I got up at night and I will go outside. When I couldn't breathe, I would get up and I'll go outside and stand among the trees I worked for the police force for a little while, and our times. But sometime, believe you, and maybe this is tear gas training was, if you can't breathe from the tear gas, get into an oxygen flow, deep breaths and the rest of it. I did that a couple of times, brought relief, and I went back inside. She didn't even know I was out of the house.
Wow.
All right, so that was dangerous. And the other thing too, I had to sit up and sleep. Men, it's not an easy thing. I tried to lie down to sleep, and every time I lie down, I would just jump, boom, my body would just pulsate. So I had to sit up and sleep.
You just started to pulsate?
Yeah, right, all right. So I had to sit up and sleep. A couple of pillows piled, and I would just rest my head on those pillows, and that was comfort. Then I had hiccups for 2 solid days.
This is before the first incident.
Before the first incident. Hiccups were there. But my advice to all of us, whether we have a heart condition or not, both men and women, there are no symptoms that are, in terms that all of us will understand, small symptoms that we could allow to not have checked. It's very important to have all of these things checked. But today, I'm happy again that I'm here. And, sorry?
You are here. A true picture of good health. You're smiling, you credit, God and your family, and everyone who pulled together. What did this, how did this impact your family and your friends, everything that you were going through? Well, and your wife, of course, who you were so concerned about in the first place.
In the first.
Yeah, what was that like?
Yeah, it brought, I'm sure they worried quite a bit, because the condition that I was in, I lost weight rapidly. Within a couple of weeks, from 96 pounds to 150 pounds. Huh. I was like a kite. If the wind got high, like the wind will blow me away. All of my features changed. All right, there's so many things, and the worst of it with heart conditions and family, there's no guarantee that whatever the surgery or the end result is, that you will be with them for a while. The time was so short, you don't have time to sit down and have conversations with the family as you should. Prior to, none of us know when we will go, but one will expect to sit down and have conversation with the family to a great extent in the event something would have gone awry, and I did not return. And what was more frightening than anything else was the morning when I went, when I was admitted to Mount Sinai, and I was prepared for surgery. The anesthesiologist asked me if I'm ready. If I'm not ready, he's not going to send me. And it kind of sent, I became worried for a moment, all right? If I'm not ready, he's not going to send me. So if I'm not ready and he send me, that means I ain't coming back. Well, that came to mind. Mm-hmm. So I said to him, man, give me 2 minutes, let me have a conversation with my children, and then we'll go from there. But those 2 minutes, I turned to the Master. Mm. In your hands, Heavenly Father. And I said to the anesthesiologist, yes, I'm ready. Whatever's necessary, you can go ahead and do. And I was ready, because I've already prepared myself. Not to go and not come back, but I prepared myself for my return, in my mind, that is, right?
So how have things changed for you? How have you, what are you doing differently now since your health scare?
Well, diet plays an important role. Extremely careful with some of the things I eat, and some of the things I used to drink, among other things. Don't do that anymore. And I followed the instructions of the doctors to the T. In actual fact, the thing for me was, because of the type of surgery I had, there are only certain things I could have done. I couldn't raise my arms above my shoulders. All of my shirts were cut down the front when I put them on. Mm-hmm. Oftentimes I had to just leave my chest open, exposed. Well, there was nothing wrong with that, because there were medications that we will put on to get it done. And right now, today, all right, a lot of the things I challenge early in life, I will not challenge those things. And I will advise all men and women, listen carefully to your doctors, man. All right, and what is more important also, though, for those of us who are involved with in relationships and are married, all right, treat each other with respect, man. Because the thing about it is, we might say, well, boy, I got a nagging wife, I got a this, I got another. But the wife is concerned about your health. Mm-hmm. And your wife would like for you to be with her as long as you possibly can. So I've got to see it this way, rather than seeing it as being badgered for whatever reason there is. It's for my own good. And my doctor visits initially were every month, every 2 months, every 3 months. Now my doctor visits are continually every 3 months. So I'm doing fairly well. I'm doing great. I wish I was able to go back to work, but
just take it easy.
Every man will wish that, right?
Right. Take it easy and follow the doctor's orders, Mr. Sands. We thank you so much for being here and sharing your story, especially for men because
Yes.
hearing it from you, they may take it a little better than hearing it from me, or
Right.
even sometimes hearing it from the doctor. So we thank you so much for sharing your story. Stay with us. The Health Zone with ZNS is back in just a moment. We have our my guest host with me back again right after this, Dr. Mesples, and we are going to be talking about heart health and your children. Stay with us. We'll be back.
You're watching the ZNS Health Zone.
For all your insurance needs, life, health, homeowners, marine, and so much more, we are Freeport Insurance agents and brokers located at Freeport Insurance Center, number 21B West Mall Drive, Freeport, and in Nassau at Suite A3A, East Bay Plaza, East Bay Street. We specialize in you.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Insurance Management Bahamas Limited.
Maintaining strong relationships with superior customer service. Fulfilling all your insurance needs through commercial, property and casualty, marine and aviation, homeowners and contents, automotive for private and commercial, life insurance, medical, and pension investments. Being the best at who we are in Freeport since 1980.
Insurance Management Bahamas Limited.
A name you've come to know and trust.
We've always been there for you.
So call us today at 350-3500 or visit our office on Pioneers Way.
Insurance Management Bahamas Limited. Honestly,
Nobody does it better.
We all need to save. Save time, gas, and money. Shopping at Save More can help you do just that. Make us your first stop for all your prescription needs and medical supplies. Get all your health and beauty items at the same time. And don't miss our huge choice of snacks to satisfy your cravings. And the largest vitamin selection and over-the-counter relief products. Need diapers and other baby care items? First stop. The new section for makeovers, cosmetics, and beautiful jewelry will make you sparkle for that next special event. Save More Drugs, your more store.
Make the best decision of your life and become an active and valued member of National Workers Cooperative Credit Union today. Call 352-9624 or 826-8670. National Workers Cooperative Credit Union.
Doctor Hospital have a great commitment with Freeport, with Grand Bahama. Dr. Hospital made a great investment in the building. We are a great team. We can check everything in cardiovascular problems, working with ECG, of course, with Holter monitor 24 hours, echocardiogram, stress test, and eco stress. So we have more than 100 patients in the last 3 years with very, very good results. 80% of population have hypertension. 60% of patients have diabetes, and around 40% of patients have more risk factors. These patients need support, need technology, need a team, no? a cardiologist, no a technician or a machine. Need a team because the risk of complication in this patient is very high.
You're watching the ZNS Health Zone.
Welcome back. As you may be aware, heart disease also affects many children here in the Bahamas. Next, we take a look at how a baby was diagnosed and 12 years later, what a progress looks like.
The journey of pregnancy brings excitement to mothers-to-be, especially for the first time. Although she was anxious to become a first-time mom, Latoya says she couldn't wait to meet her bundle of joy. And 12 years ago, she gave birth to a beautiful baby girl she named Halo.
I was pretty happy because that's my first time going to be a mother. My 9 months was pretty normal pregnancy.
But immediately after giving birth, that excitement quickly turned into fear as Latoya was informed that her daughter had several severe health issues.
When I had her, there was a little bit of emergencies in the delivery room. She did end up swallowing some of the fluid, and she had the cord wrapped around her neck 3 times, so there was trouble with that. So they had to just take her and push her away, and she spent about a week in special care nursery. And within that time frame is when they found out that she had the multiple heart disease issues.
She says she had to transport her daughter to New Providence to see Dr. Jerome Lightbourne, a pediatric cardiologist who examined Halo's heart.
And that's where he found that she had 3 holes in her heart, and one of her veins are too small, and she had problem with oxygen flow and also blood flow.
And if you can't imagine the feeling as a mother, knowing that her child has mounting health issues, then you would understand exactly how Latoya felt in that moment.
I was heartbroken because I knew life would be a struggle for her. I was trying to understand mostly, how it all happened and how could this happen, and that was just my worry at the time.
She says the journey has been difficult, but Halo is making progress.
Because she also has other issues along with her heart problem. She has seizures, she has a brain condition, it's very rare, so it affects her overall function, her learning and everything. So that playing with the heart, it's been a lot. She's had to have physical therapy, occupational therapy.
Latoya reveals that she is a mother of 3, and apart from Halo, her son was diagnosed with autism spectrum disorder. When asked how she manages with 2 challenged children,
in the grand scheme of all, who are we to question God? We never know why. You'll drive yourself crazy thinking why, all of these issues are happening, even when it comes to anything in life. So the best thing you can do is to try to be strong and move forward. There's nothing that you can do to change it. There's nothing that she can do to change it. So you have to stay positive.
Joining us once again is Dr. Mesplas, a cardiologist at Doctors Hospital. Dr. Mesplas, my first question is, what are some of the signs or symptoms that parents should look for when it comes to heart disease in children?
Okay, in children, the heart disease is totally different than in adult people. And probably 2 more frequent issues is the first, the children with tachycardia, with very high heart rate, and also shortness of breath when move or when eat. these children with heart disease, with congenital heart disease, genetical heart disease, have tachycardia and shortness of breath. I think right now doctors can do the diagnosis of cardiac heart or heart disease with echocardiogram intrautero in the pregnancy. No wait for the delivery.
Is that new, that you can do that during pregnancy? Is that something new, or has that always been the case?
No, depend of the patient, depend of the case, but right now in big hospitals in the United States or other countries, doctors can make surgery in the intrautero.
I know I think we would have sent a strong message to not delay when you're having any symptoms. You come in here, to Grand Bahama rather. How often are you here on Grand Bahama? If persons want to come to Doctor's Hospital to get that heart checked, first of all, take us through what that looks like. So I come in to see you, Dr. Masplas. What are some of the first things that you will do for me to get my heart checked?
Right now we will do an exam, an echocardiogram. Echocardiogram in this patient is very important because we need to check the coronary patency, the coronary stent patency. Patients with stents can develop in the next 1 year intra-stent restenosis, and echocardiogram is great because it's cheap, it's easy, no pain, it's very safe. It's an ultrasound, and very fast we can check ischemia in these patients.
I was having chest pains for a while, and I was told to go to Nassau. I was invited to Nassau to see Dr. Colley, and who was a doctor at Doctor's Hospital. And they did blood work and discovered that I had a blockage, and surgery or procedure was scheduled. During the procedure, the chest pain went away, and I feel perfectly normal now. Doctor's Hospital opened a new clinic in 8 Mile Rock, and I was able to, instead of going to Nassau, do my follow-ups with Dr. Andre, and here I am this morning, good results.
As we wrap up tonight, what is the stress test?
Stress test is a machine like a bicycle or treadmill with an ECG and the blood pressure control at the same time. The patient needs to move, make exercise. We have a protocol that each 3 minutes we increase the exercise and increase the blood pressure, increase the heart rate. This is the stress. We can check with an ECG if the patient have ischemia or not. It's very important. In a subgroup of patients, we can do the stress test with echocardiogram at the same time to check motility. Many patients with ischemia have hypomotility first, and then ECG changes. We can check everything. And then for high-risk patients with indication for that, we can do a coronary angiogram with a angiographic machine at operating room.
And all of this that you're talking about, all of this is available here at your Grand Bahama Center?
Yes, yes. Doctor Hospital have the technology, the last technology, high technology. We can do everything here at Grand Bahama. I think my opinion is for Grand Bahamas, this project of Dr. Hospital is great because people no need to move, to transfer to Nassau or other countries. We can do the procedure here with normal life, because many times for patients that we transfer to other countries, to other islands, it's a big problem for the family, for the community, and it's expensive. I think it's a very good option. And Dr. Hospital have the equipment, the machines here.
And that is right at this FMC Center, correct?
Yes, correct. It's correct.
How often do you come to Grand Bahama, Dr. Masplaz?
It's a good question. I know my first time in Grand Bahama was around 6 months ago or something like that.
So your visits are how often? Every week?
Yes, every week, every month. With these holidays, you know, is difficult, but Freeport is, Grand Bahama is beautiful and is quiet. It's very, very good, and I am happy to come here.
Dr. Masplaz, we just want to say thank you for traveling to Grand Bahama. We also say a special heartfelt thank you to Doctors Hospital for partnering with ZNS to promote a healthier lifestyle for Bahamians. We hope that this show was informative, engaging, and entertaining. I have to say a special thank you to my producer, Kirk Cooper, as well as the entire team and everyone who has joined together to be a part of this special initiative. Next month, though, we will be back again talking about kidney disease with Dr. Monique Pratt. Same place, same time, last Monday, every month at 8 p.m. only on the ZNS Network. I'm your host, Shoshana Roll-Parkinson. Make it an enjoyable evening.
ZNS Health Zone was brought to you by Doctors Hospital. Other sponsors include the National Workers Credit Union, Freeport Insurance Agents and Brokers, and Insurance Management.